In the distant past, patients were sometimes restrained as a means of coercion or even as a punishment. There were also cases where they were restrained because of staff shortages or for convenience. Today, we all recognize and honor the patient's legal rights and dignity. Still, this is so important that federal law and the Joint Commission for Accreditation of Hospitals both require annual training on patient restraints and seclusion. After this course, you'll be able to describe 2 justifications for using restraints. Identify 3 categories of alternatives to restraints. Describe 3 documentation requirements. Identify 3 special rules for behavioral restraints. And list 3 precautions for the safe use of restraints. Restraints can either be physical devices or drugs used as restraints. A physical restraint is anything that physically restricts a patient's freedom of movement and that the patient cannot easily remove. A drug restraint is a medication that is administered for the purpose of controlling the patient's behavior or movements. Medications used as standard treatment of a medical or psychiatric condition are not considered restraints. On rare occasions, seclusion in a locked room may be justified for behavioral control. There are only 2 justifications for the use of restraints: to protect patients from injuring themselves and to protect others from the patient. During acute medical or surgical care, patients may unintentionally injure themselves by pulling IVs or endotracheal tubes. The restraints are a normal part of the patient's medical and surgical care. The behavioral health use of restraints is a special case where the emergency use of restraints is required to control violent behavior. If a patient strikes or attacks other patients or staff, the emergency application of restraints may be justified to protect others and perhaps the patient from physical harm. Before using restraints for any reason, you must first consider alternative measures. 3 categories of alternatives are physiological, psychosocial, and environmental. Carefully consider physiological alternatives. The patient's behavior could be caused by a correctable medical problem, such as an adverse drug reaction, a fever, hypoglycemia, or pain. Be sure that the patient's physical comfort and elimination needs are satisfied. Look for psychosocial alternatives that might calm the patient. If appropriate, try talking with the patient using de-escalation techniques. Try providing distractions such as a television or radio. Consider increasing visitation. Family members often know how to calm their own relatives. Look for environmental alternatives that reduce the patient's need to move about. This may include making the TV remote more accessible or simply placing a water glass and urinal within easy reach. Finally, when alternatives won't work, choose the least restrictive restraint possible and remove restraints as soon as practical. Your facility requires special documentation when restraints are used to protect the facility and you from legal action. It's very important that you know and follow these policies. First, make a greater than ordinary effort documenting the evaluation and decision-making process. The evaluation must show that the use of the restraint was well warranted. It should include a description of the danger to the patient or others that justified the restraint. List the alternatives that were considered or that were tried and failed. Describe any special nursing services that will be required. These will include providing for the patient's nutrition, hydration, and elimination needs. The patient will usually require more observation and nursing services, not less. The second documentation requirement is for an order authorizing the restraints. Verbal orders must be authenticated by a physician or authorized practitioner within the time specified by your policies. The order must be time-limited, specifying a stop time. Standing or PRN orders are never allowed. Finally, document your ongoing assessment and care of the patient. 3 special rules apply to the use of restraints for behavioral control. First, a physician must evaluate the patient face-to-face and sign the order before or shortly after the restraints are applied. Second, orders must be time-limited based upon age. Be sure to check your policies for the time limits for this process. They vary greatly depending upon federal and local laws, the patient's age, and the type of facility. The initial orders for children under the age of 9 are limited to 1 hour. For children 9 to 17, they are limited to 2 hours. For adults, initial orders are limited to 4 hours. Finally, a re-evaluation and new order must be written after the time period set in your policies. Orders cannot be renewed indefinitely. Again, remember, these 3 rules apply to behavioral restraints. The patient must be evaluated face-to-face within the set time after restraints are applied. Orders must be time-limited based upon age. 1 hour for children under 9, 2 hours for children 9 to 17, and 4 hours for older patients. A new order and re-evaluation of the patient is required after a time period specified by policy. There are 3 general steps to ensure the safe use of restraints. First, be sure to apply the restraint properly. Read and follow the manufacturer's instructions. Pay special attention to warnings and cautions. Be especially careful applying vests. Patients have strangled when vest restraints were put on incorrectly.
All right, Mr. Walters, we're going to go ahead and put some restraints
Patients should
on
not
so
be
we can
restrained
wake up.
lying flat in bed. They could aspirate and choke. The restraint should not be so tight that it reduces circulation or causes pressure sores. Restraints should be tied to parts of adjustable beds that will move with the patient. They should not be tied to bed rails. Second, monitor the patient frequently.
Hi, Mr. Walters. How you feeling?
Fine.
Look for circulatory and neurologic problems near restraint application sites. Finally, attend to the patient's
All right, here
needs.
it is.
This includes nutrition,
A little bit.
hydration, and elimination. Remove the restraints occasionally so the patient can exercise range of motion. Discontinue the use of restraints as soon as possible. Restraints should be used only as a last resort. But when they must be used, it's important to talk with the family and the patient about why they are necessary. Your facility's policies and procedures protect it and you from legal actions. It is very important that you know and follow them carefully.